Great. Good morning, good afternoon, and good evening for those who are joining us from around the world. My name's Lori Heisey, and I'm the Technical Director of the Prevention Collaborative. And I really want to welcome you to this webinar today on preventing family violence with gender-transformative parenting programs. Could I have the next slide, please? So for those of you who may not be familiar with the Prevention Collaborative, we are a fairly new global and virtual network of researchers and activists and practitioners who are really trying to equip ourselves and others in order to do better prevention programming. Our focus as an organization is on curating evidence and helping practitioners, the people who are actually implementing programs, including ourselves, to do that work better. And so we invite you, if you are interested in the issues of prevention and in learning more about it, we invite you to join the collaborative and meet up with us. And we'll show you how to do a little bit more of that at the end of today. But I wanted to just quickly turn things over to my colleague, Juliana, who is going to take us through just a few housekeeping matters so that we can collaborate better today during the talk.
Hi, everyone. This is Juliana. I just wanted to share a few housekeeping items to make sure that we keep engaged with each other. So the webinar is being recorded and will be shared via email after this event. We will have time for question and answers at the end, and there's two ways you can engage with us. You can either type your questions directly in the chat box at any point during the webinar, and you can see that here highlighted in red at the bottom of the slide. And we do ask that you make sure to change the chat box to all panelists and attendees so that everyone can see and respond to you as well. You also have the option of raising your hand, and again, you can see that at the bottom of the screen in blue. During the Q&A, and when you raise your hand, we will call on you and unmute you so you can ask your question out loud. So yeah, thank you. We look forward to engaging with you throughout this webinar. Back over to you, Lori.
Great, thanks so much. Well, hopefully we're all getting just a bit better at how to collaborate virtually now that we've been in this mode for a while. Let's take the next slide, and I want to tell you a little bit about who we are excited to have with us today. So our first speakers today are both from UNICEF, and they're both very close friends of the collaboratives. The first is Lauren Rumble, who is based in New York with UNICEF, and she is the principal advisor of gender equality for UNICEF and their gender lead. And she has worked for many, many years with UNICEF and other organizations working to improve the lives of women and children. And like us at the collaborative, really focuses a lot on translating new knowledge into practical action. The second person we'll hear from is also a really close friend of mine in the collaborative, is Alessandra Juerez, who spent a lot of her years with the Pan American Health Organization and is now a research manager at the UNICEF Research Center in Inocente, Florence. So we are actually, it's the Intergenerational Center, I should say, in Florence, of which we are all aspiring to have her job in terms of being located in such a beautiful place. But Alessandra also has worked a lot on the intersection between violence against women and children, and we're really excited to hear about her work that she's now doing through UNICEF. And then our third speaker is actually part of our staff here at the collaborative, is Lina Digolo. She's a senior associate. She has also worked a lot on violence against children and has joined joined our group here at the collaborative in order to take forward our work at the intersections of violence against women and children. She has been leading that work for the last 2 years and is also an epidemiologist and medical clinician, pediatrician by training. So we're really pleased to have everyone on board with us today. And we also will have a few additional discussants that I'll introduce towards the, before they join us for the discussion. But I think we'll just use our time to turn over the floor to Alessandra and Lauren, who I believe are giving a joint presentation, and we'll first hear from Alessandra. So welcome.
Actually, Lauren is going to start us off and I'll come in. Thanks, Laurie.
Okay, so my mistake. We're going to first hear from Lauren.
Hi, everybody. Good morning. Thank you so much, Laurie. It's such a pleasure to be here today. A big thank you to the phenomenal team at the Prevention Collaborative for bringing us together and facilitating this conversation. There's incredible amounts of people joining us today, practitioners, researchers, and champions from all over. And it's a conversation I'm really looking forward to. And I want us to be as engaging and interactive as possible. So while we're talking, Alessandra and I will share the presentation. Please make use of the chat function if an idea or concept particularly resonates with you as we're speaking, or if it doesn't. We are on a learning journey, and that's part of what I'll be speaking to today. Next. The context of our presentation is an exciting moment for UNICEF. As we leap forward into this last decade of the SDGs with the COVID realities heavy on our shoulders, UNICEF is developing a new programmatic vision 2030. Specifically, 2 dedicated strategies for gender equality and child protection are under finalization. We knew when we began designing the roadmap for these strategies that we needed to be evidence-based and data-driven. We also knew we needed to be creative and work differently, listening to our 190 countries on the and the children they serve. One issue that consistently came up in our conversations with field colleagues was to think more about how violence against women and children intersect, and how to be more deliberate about tackling the gender dimensions of such violence. And that became pressing in the COVID-19 context. Alessandra, over to you.
Thank you. And Laurie, as you were saying that we should by now figure out how to use Zoom, I couldn't unmute myself. So hi, everybody. It's really nice to be with you. And so, as you know, the topic of the conversation today is around parenting as an intervention to address both violence against children and violence against women. And what Lauren and I are going to do is sort of set the stage about these intersections, specifically looking at a paper that UNICEF developed and published recently on the gender dimensions of violence against children and adolescents. And I just wanted to give you sort of an overview of how that paper came about. Lauren mentioned the motivation behind the paper. And so we had a really fantastic group of colleagues, not just putting the paper together, but also external reviews and internal reviewers. I refrained from putting on this slide, but we had 11 versions of this paper before it got published. So you can get a sense of all the conversations that went on behind it and that are have been really instrumental and important for us at UNICEF. Perhaps I don't need to say this to all of you, but we know that this is not a problem of a minority of children or women. In fact, we had WHO, UNICEF, UNFPA, and UN Women releasing data just a few weeks ago, showing not only the pervasive nature of violence against women, but the fact that it starts quite early in life. Again, you know, these are global human rights issues and public health issues. We all are familiar with the different SDGs and conventions, etc. But the point of this slide is to highlight and remind us that these forms of violence are not just a manifestation of gender inequality, but they are very much a mechanism to reinforce those unequal gender power differences. And that's at the root of both violence against women and many forms of violence against children. So when we were putting together this strategy paper, which serves as a background paper to feed into the documents that Lauren mentioned, the new gender policy and action plan and the new child protection strategy, as well as the new UNICEF strategic plan that's also under development, we were looking at the rationale for paying greater attention to the gender dimensions of violence against children and adolescents, and that includes addressing the intersections with violence against women. We were looking at the existing frameworks and how they connect, reviewing the evidence around effective gender transformative strategies, and then pinpointing recommendations and ways that UNICEF can strengthen its work moving forward. And so I'm going to just briefly mention points 1 and 2, and then Lauren will come back and address the other aspects of the paper, which is available online. And so we'll be sharing that with you via the chat. So why do we need to look at the gender dimensions of violence against children and violence against adolescents? Well, it's pretty simple. The levels, the patterns, the risk factors for violence are different for girls and boys, for men and women. We know that women and children are much more likely to experience violence by those who are close to them. And at the same time, we know that men are the greatest victims of homicide in terms of number, although women are much more likely to be killed by a partner than men are. Similarly, we see that by and large, girls and adolescent girls are more likely to experience sexual violence than boys, while boys and young men are more likely to be victims of homicide. So it's very easy for us to get into this, this is worse than that, or this form of violence is worse than that, or boys are worse in worse situation, or girls, and that's not the point. The point is that it's different, and because these levels and risk factors are different, they require different strategies to intervene and prevent. So what's the purpose of using a gender transformative approach? Well, recognizing that gender inequality and violence are mutually reinforcing, and that unequal gender norms contribute to violence at many different levels. We know, for example, that at an individual level, boys and men who espouse unequal gender norms are more likely to perpetrate both violence against children and violence against women. And at the national level, we have some really interesting data showing us how norms condoning male control of female behavior and the extent that laws disadvantage women compared to men are really the strongest predictors of the frequency of violence against women. And so we know that these structural gender inequalities increase the vulnerability to violence. Of course, this vulnerability is compounded by a number of other intersecting risks and vulnerabilities, whether that's race, disability, migratory status, and so forth. So several years back, or a few years back, we published a review looking at the ways in which violence against children and violence against women intersect. It was called Bridging the Gaps. Some of you may have seen it. And we identified some of those main ways in which these forms of violence intersect, including shared risk factors, and amongst that category, gender norms and social norms being a strong component. We know that those forms of violence tend to co-occur in the same families and same households. We also know and are increasing our knowledge about the intergenerational effects of these forms of violence and how exposure to one form of violence can lead to experiencing greater risks of experiencing violence later in life. We also know that these forms of violence lead to common consequences, and that if you've experienced more than one, not surprisingly, the consequences are compounded. And we also found that adolescents, while they should be a group that both those who are looking at violence against children and violence against women look at, in fact, what happens is they sometimes end up getting lost. In terms of specifically intimate partner violence and harsh discipline or violent discipline in the home, again, we know that they tend to reoccur or co-occur in the same household. We know that children whose mothers experience IPV suffer negative consequences, regardless of whether they experience violence directly. Simply, and I put simply in quotes, witnessing those forms of violence have very potentially dramatic consequences to children. We know that exposure to violence early in life amongst boys tends to increase the risk of them becoming perpetrators later in life, and for girls becoming victims of both IPV and sexual violence. Again, we know that there are some common roots and risk factors for those forms of violence, including gender inequality, but also the acceptability of violence, specifically as a way of quote unquote disciplining, whether it's children or women. And we also know that the acceptance of wife beating tends to correlate with the acceptance and use of violent discipline against children. In terms of the intergenerational effects of violence, really the pathways by which IPV affects children are quite complex and gendered and sometimes or often contested. So we have some research suggesting, for example, that women who experience IPV may have poor mothering skills. Then we have some research that questions that finding. We have some research suggesting that maybe it's men's controlling behaviors that lead to behaviors amongst women that lead to negative outcomes for children. And we have a lot of people saying, hey, why are we not looking more at the behaviors of men who beat their wives as fathers and how they're behaving with children in the household. So that's an area prime for greater investment in research and learning. What we do know is that women who live in a violent relationship face really difficult decisions in terms of how to protect their children, and that some women decide to stay in that relationship to protect their children because they know the risks are greater if they leave, and other women may choose to leave the relationship in order to protect their children. The bottom line is that there are a number of gender biases about mothers and fathers and how they're supposed to behave that affect not only their research, but also programs and policies. And that's an area where child protection or those working on violence against children and those working on violence against women often find themselves in certain situations that are that can lead to tensions and difficult differences in opinion in terms of how to design programs and policies. Again, I've already spoken a little bit about adolescents, but it's really important for us to remember that this is an often overlooked age group. Those who are working on violence against children, not always, but sometimes tend to look at younger children, whereas those working on violence against women tend to be looking primarily at reproductive health age women, sometimes looking at the age group of 15 to 19-year-olds, and sometimes not. At the same time, we know that adolescence is a period of both greater vulnerability to these forms of violence, but as well as an opportunity for intervention. And in terms of the LGBTQ+ community, that can be an age group for heightened risks of violence. I'm going to just flash this. Everybody should by now become familiar with the INSPIRE and the RESPECT frameworks. You will see that RESPECT recently produced an implementation guidance. And what I want to call your attention to is that if you mess those letters around, you'll see that both frameworks are looking at very similar interventions. And so the point is, how can we do this more systematically in a more coordinated way? Over to you now, Lauren.
Thank you so much, Alessandra. Let me whip through the final moments in terms of looking at what a gender perspective means in practice. Next. There's no international consensus on what we found looking through the literature, but here's our take. And we argue that a gender transformative approach tackles root causes rather than responding to current those underlying structural barriers and common roots of violence that Alessandra just talked about. Next. Similar to many organizations like CARE, Plan, and the Gates Foundation, we've developed a tool programmatic efforts, the gender continuum. We first started using this tool in our joint program with UNFPA to end child marriage. And in this program, it's meant shifting away from a largely service delivery focused approach for adolescent girls and investing more deliberately in norms change programming with communities, with families, and at the budget and policy level. Supporting girls with assets and opportunities for agency is also at the heart of this work. Next. So what does that mean for violence prevention work more generally? Well, we know that we need to be more transformative, but the evidence on what this kind of programming looks like is still emerging, as Alessandra alluded to. Further, when we do start to have evidence, most focuses on individual rather than at-scale systems change, as this slide shows you. And there's also this continued perception that gender transformative approaches are complex and take generations. Our main partners are governments who don't have that kind of time or bandwidth in their fiscal reporting cycles. And we know that that's actually incorrect, but the evidence is not yet on our side in terms of scale and quantity. So we're asking ourselves at UNICEF, how can we expand those existing models of good practice that we know are out there that have been well documented without compromising the quality in their scale up and replication? And the most common ask from practitioners, at least in our team, is, okay, we understand the why. That data that Alessandra presented is so powerful, but what about the how? Next. So let's dive into a couple of programs. Next. I'll pay practices around the world and propose options for going forward. 9 ways to be more gender intentional in our work, and ultimately these action areas range from legislative and policy reform, for example, prohibiting sexual violence in all forms, including in marriage, to specific investments in gender responsive caregiving and parenting, which the other panelists will speak to in more detail. I want to share 2 examples with you from our side, including on community norms change and girls' empowerment. Next. And you can click again. In Somalia and South Sudan, 2 countries which are notoriously complex operationally to work in, we've been able to work for a few years to roll out the Community's Care Initiative with government, civil society, and research partners. The program works with young people, caregivers, and government frontline workers to really promote awareness of gender-based violence, improve integrated survivor services. So not just violence against children services or violence against women services, but a more holistic approach, accessible regardless of age or gender identity, and addressing norms about the acceptability of violence. A key outcome indicator for this work was acceptability of violence amongst young people and adults. And as an aside, you may know that globally we're looking at 1 in 3 young people believing that wife beating is acceptable for any reason, especially high amongst adolescent girls. And so with this comprehensive approach, and particularly because of those diverse partnerships, we've seen significant shifts in beliefs and attitudes justifying violence. We've actually managed to move the needle collectively on that pervasive indicator. We've also seen system improvements, such as increased reporting of incidents of violence, which is a proxy for whether the system is actually working. We're learning some hard lessons, though, about the replicability of this program, which was originally designed as an action research program. So those upfront investments in training of facilitators, monitoring there. One of the most important takeaways from in our view, though, is that it shows norm change is possible in a relatively short period of time in a very difficult context. And so with this kind of success, we need to ask ourselves why we don't do these kind of programs more. Next. Globally, we're also recognizing that for us to help break barriers for girls and to truly be more gender transformative in an organization like UNICEF, we need to partner with girls in a way that addresses their needs, but also as legitimate forces for change in their own right. We're trying to do this in a more targeted way by setting new goals for adolescent girls in all the sectors where, for example, in WASH, you can see a picture here of a young girl talking about menstruation in her mixed school, her co-ed school. We want to see global coverage of menstrual health and hygiene supplies, but also programs that tackle taboos and stigma about menstruation in the long term. Another example would be in HIV. We know that 3/4 of new HIV infections concentrated amongst adolescent girls. Why then is most of the world's attention and money focused on testing? We've got to get at that power imbalance and lack of agency that girls have to make decisions about their bodies and their lives. Too much of the world's attention is focused elsewhere and not exactly on those root causes. Next. And next again. So in conclusion, I want to summarize where we are as next steps, and I'd love to hear how this is resonating with you, what you think, what are we missing here? Where are we going through from here is that first to intentionally recognize in all our programming that gender equality is a core value and a principle of the work that we do. And that we must lift the bar much, much higher from gender responsive and gender aware to gender transformative. But it is a learning agenda with multiple research goals as described in the left column. In programmatic action with impacts in the lives of children and women. It means programming for children and those who care for them. including women, without reinforcing unpaid and unequal labor. Too many of our parenting and caregiver programs, in fact, the vast majority, focus on teaching women how to nurture and care for children, with little to no engagement with male caregivers. We need to really systematically include men and boys as true partners and champions for equality, setting up clear accountabilities for what this means in household decision-making, childcare, and parenting. We should start having indicators for those. Investing in girls' education and skills in COVID-19 recovery plans is a must, so that girls are not the ones taking care of growing family needs as economies take strain. Trying to push for parental leave, child subsidies, and other gender-responsive social protection systems, because we know that this will mean dividends for all. The road ahead is long and challenging, with the world facing multiple crises of climate, health, inequity, and instability. But COVID-19 has also done something extraordinary. It's showcased the power and potential of women and girls' leadership, and that we must harness that power and potential to disrupt the norm in traditional parenting and other programming, building back a better, safer, and more equal future. Thank you so much.
Great. Thank you so much for that great introduction. I realize that there's a couple of questions that people have put into the chat, and if you will indulge us, what we'd like to do is wait until the end and then kind of take questions, but we're tracking them all, so we will get to that. We wanted to start with this foundation because we think it's very important to see how kind of the global discourse is changing and the interest in this area. At the same time, as an organization, many of us come from the history of working on violence against women. And we have been in many conversations over the years about some of the challenges of trying to work creatively with a gender perspective in a family system, which is where women live, right? And we've also recognized, as more and more research has come out, just the incredible links between exposure and experience of violence in childhood and future risk. And while clearly not everyone who experiences that goes on to have kind of intergenerational repeats of that pattern, most people that actually do perpetrate or have some issues in the future have experienced childhood violence. And so as an organization, we really wanted to try to figure out, how do we take this beyond understanding the importance to actually figuring out what programming looks like? And I think as a field, that's sort of where we're at. As part of one of our first efforts there, in order to advance this dialogue, we actually went forward with a kind of global review to see, what do we know? What are the examples? We heard some from Lauren from UNICEF, but what examples exist of people who are trying to do programming that look at both IPV as an outcome and reduction of violence against children or harsh discipline? So I'm going to turn things over now to Lina Digolo, and she's going to introduce a little bit of our findings from that work to try to say, landscaping, where are we at now, and what can we build on and going forward? So let me turn it over to you, Lina.
Thanks, Laurie, and thanks, Lauren and Alessandra, for just setting the stage for the conversation that we're about to have next. I think you've made a very good case for why at the collaborative we opted to focus on this area of working around the intersection of violence against women and children. And I think for the next few minutes, I'll just zoom into the work that we've done in choosing parenting programs. Why did we decide to choose parenting programs as the platform that we will take forward this work? Next slide. Next, please. So we've had already an introduction of the collaborative, and Laurie has given quite a good overview on why we opted to work around VAC. Next slide, please. For the next few minutes, I'll just take you through some of the work that we did in 2019, really trying to understand the space well, what is there out there in regard to parenting programs that are responding or working at the intersection of violence against women and children, and just starting to understand what the programs look like and assessing what their common components were within those programs, or what shared characteristics they have. So that's where I'll focus my conversation. Next slide, please. Next slide. My life is easy. Most of this has been done. So just touching a bit on what we just heard from UNICEF. We know traditionally parenting programs have actually focused exclusively or just mainly focused on facilitating facilitating sessions with parents to that are focused on the health of the child and healthy child development. And despite all the evidence that we are hearing, I think UNICEF has done a good job on that, we know that very few have actually extended their efforts to address the causes of violence, that to address the childhood causes or origins of violence that could affect the child in future in terms of exposure and perpetration of violence against children. So in regard to why we opted to work at the intersection, and particularly through parenting programs, in a nutshell, it's that we know that the violence against women, especially intimate partner violence, violence against children, especially child maltreatment and harsh discipline, are co-occur in the same homes. The child maltreatment and intimate partner violence have similar risk factors, as we had Alessandra mention, and we know that intimate partner violence has negative impact on the parenting capacity of the caregiver, especially the mothers, and that the children whose mothers experience IPV also are more likely to experience or suffer negative consequences in future, including their negative health outcomes. So with all this in mind, we think that parenting programs could be and should be actually working within incorporating components that include prevention of violence against women and children. Next slide. So I would like to talk to you about some work that we did in regard to just generating or just beginning to understand what's out there in regard to evidence in this space. Next slide. And what we did was we conducted an evidence review, and what with the methods, in terms of methodology, we looked at evidence review that built on previous evidence, and that identified the papers that we looked like had identified rigorously evaluated programs with those that had positive impacts on VAC. That could be violence against women, children independently, or both violence against women and violence against children jointly. We complemented, the review really focused on 3 types of programs: those that intentionally sought to reduce either VAC or IPV, or those that did not necessarily deliberately intend to, or had components that were intended to reduce both, but measured results and found promising results on reduction of both VAW and VAC. And then we also looked at programs that sought to reduce the factors associated with increased risk for violence within the family. We complemented this review with a series of case studies whereby we conducted in-depth interviews with service practitioners from the either those who had implemented the programs or evaluated the programs, and also and out of this we then identified common approaches across the different programs that we had a deep dive on within the case studies to start seeing what similarities they had. Next slide. So I'm going to spend a bit of time just talking about some of this work, and I would encourage you and invite you to look at the paper. You can find it within our sites, and maybe we can share it in the link in the chat, because we did a review of about 11 programs, but today I really focus on the 5 programs that we found that showed a reduction both VAC and IPV. This was not a common finding. Majority of the programs that we found in the review were deliberate on reduction of VAC. Very few intentionally or deliberately designed to respond to IPV or measure IPV. And in fact, only these 5 seem to have looked at IPV as one of their outcomes. So another thing that we found that was on these programs, that majority of them really focused on younger children. So maybe children in less than 5 years, so in lower, school, before starting school, and just pre-primary school. So that was another thing that we found across all the 11 programs. The review really found scarce evidence on programs that were deliberately designed to respond to this. Even the ones that you see here that showed results, most of them were sort of like incidental findings. I think only 2 or 3 were deliberate on this, and I think Real Fathers and Program P and maybe Safe Homes were the ones that were very deliberate in their design. But others seemed to measure it at the end and still found some good findings. Next slide. So this is just, just go back to the slide. Just go back to the slide before. I just wanted to touch a bit and show you some of the results that came out from the 5 study. And if you look across all the studies, the 5 studies that we pulled out that had either deliberately designed to respond to IPV or VAC, or had a reduction in IP on VAC. One of the key things that we found was that even as they measured the violence against children, the findings were mainly reported by the caregivers and not the children themselves. Apart from the Safe Home, the rest of the studies, there was reports from the parents, but at least Safe Home, is it Safe Home? No, graduation approach spoke to the children, and they said that they actually observed the reduction in violence. So that's one of the things that we really noted would be something that could be strengthened within this program. And that was similar to the IPV, whereby most of the studies, e.g. the Real Fathers and say Parenting for Respectability, the results were actually reported by the men. These were fatherhood programs, saying that they had reduced violence, but not necessarily corroborated by the women or their partners. So again, that way of measuring the reduction in either intimate partner violence or violence against children could be strengthened. Next slide. So next, I'd like to just show you a snapshot from one of the qualitative results. I mean, there was a lot that you could speak about through the case study, but for me, this was really interesting, especially from the neighbor country. I come from Kenya, Uganda. In our settings, these are really settings where fathers are rarely involved in parenting. And you can see this was a fatherhood program which really engaged men and spoke to them through a number of sessions, but also invited their partners to join, I think 6 sessions out of the 12. And you can see from there some of the studies, and even just from the photos, these are not common kind of pictures that you see in our setting where the man is the one carrying the child, but you can see some of the responses there in the first setting where the wife says, my husband was really bad news, but because of the mentoring session, those change in the home. He bathes the children, we weed together, we collect firewood, and there's total sharing of responsibilities. And you can start seeing these are some transformations already happening in terms of sharing of domestic roles and responsibilities in the home that are generally not thought to be functions that the men would do. So, and you can see this is another couple, and this is the man saying, I feel changed. I understand that in a home, we should talk over certain issues. So communication there improved that could cause serious quarrels. Be good examples to our children and use positive ways to communicate and make the home happy. So these programs, and you'll see later some of the components that they put in, such as like communication skills, discussing power. Some of these components really caused some transformations within the participants who attended. So that I just wanted to put up that to give you examples of some of the findings and qualitative data that some of these studies found. Next slide. So we found gaps when we looked at the programs that were existing. And the first gap was that the literature there was not much literature about programs that work at the intersection, parenting programs. As you can see, we only had 11 that we actually pulled, but our focus was also trying to focus on programs that have either been evaluated in the global South or at least been implemented in the global South. So that also limited the number of studies that we brought in. But despite all the evidence that we are seeing that parenting programs are a good platform to work at the intersection, it still seems like the uptake of this integration is still slow. And so in regard, another finding that we found was that the measurement of VAC and VAW was quite inconsistent across the programs. And this was in regard to the definitions that the programs used, in the terms, and even the outcome measures that they use. So it was really hard to make comparisons across the programs. Part of the other challenges that exist in regard to this is that many of the programs, and this was out of the reviews, that many of the programs actually do not have standard indicators, and they rely on self-reports to measure outcomes at the end. And so this could really cause a difficulty when you try to, do systematic reviews or try to understand what elements exist that could be effective across the different programs. I had mentioned that most of the programs that have really worked at the intersection or attempted to do that have focused on young children. So we have a gap in terms of data on programs that work with the middle age or adolescents, and that's an area that could be strengthened. There's also very limited knowledge about the pathways of change. So most of the evaluations describe the results achieved, but they did not give us detailed description in regard to what the curriculum component looked like, the profiles of the facilitators, strategies that they used to recruit, or even strategies that helped them retain the participants into the study. So that kind of detail was really hard to get. And so we were not able to give more information around the pathways of change. Next slide. So once we did that, then we spent some time just doing an analysis to understand what are those common components or shared features that were worked within, that promising components within these programs. And next slide. And we identify a few that I would like to share with you. And in regard to what we did was we separated the components in regard to what the curriculum content looked like and the delivery approaches. And so for the curriculum component, we found a number of things that were similar across the program. The first thing was that a majority of the case studies, and this while we looked at the common components, we did a deep dive, as I mentioned, to 5 studies, and the information now came from what we found from our desk review. But in addition, we got a chance to talk to the program implementers and the evaluators. So that gave us a bit more in-depth information. So the first thing that we found that was common across these programs was that they promoted nurturing and caring relationships between the parents. So majority of them focused on supporting the parents to develop positive relationships with their children and helping them to understand the importance of emotional closeness with their child, because we know that this would really affect how the child grows and how their behaviors in future. And so that was a really key thing across the programs. They also, the second thing was that they focused, a number of the case studies focused on building skills, on managing children's behavior through positive enforcement and non-violent discipline. So they gave parents different options of how they could manage children when their behavior was not appropriate, giving them options of what they would use instead of corporal punishment, and that seemed to cut across the programs. Another thing that was interesting, not many of the programs had this. This was one of the ones that were unique, maybe 3 or 4 had, where they supported parents to develop skills on emotional their emotional self-regulation skills. And this was critical. They thought this was critical for them to help their children, to help them be able to manage their own emotions. So teaching them things like stress reduction, taking, being able to take time out to relax and to ease their emotions before they can deal with their children. And this could be one of the reasons why they were able to reduce harsh discipline, but also support their children to learn how to regulate their own emotions. The other component that came out, and this was quite rare, but I think the fatherhood programs that I mentioned, their program P, Real Fathers and Parenting for Respectability, had this quite strongly and very deliberately. They had a component that helped them promote gender equitable relationships with the family. And this was, they did things like support, help parents think through how they make decisions within the home, how they solve problems, what roles they could share within the household, their communication skills, and they did this practically through groups and role plays, and even gave them tasks to go practice at home. So that was a very unique component that majority of the programs did not have, but some of these programs that were deliberate on gender transformation included that component. Those also, again, the fatherhood programs had components that really engaged. They were very deliberate on engaging fathers and having modules that were really speaking to fathers and fatherhood and how to parent. So that was something unique again on those programs. Next slide. So in regard to approach and delivery methods, there were key things that we found across these programs were, one, the one thing that was across was that cut across all programs was the program intensity. So we found that most of the programs had sessions that were between 12 to 15 sessions, not less than that. And I think only one had more than that. That was Parenting for Respectability, which had 22 sessions, but really showed us that you needed a certain, a certain intensity to be able to deliver to transfer the information and to inform some of those skills that you wanted to give to the parents. Another thing was that the most of the programs used modeling behavior and interacting exercises where they engage the parents within the group sessions to do role plays, to have conversations, to act what they would do in case of certain scenarios. And that really sort of like help the parents really, practice some of the skills that were being given to them by the facilitators. We found that there was a combination of methods that were used by most programs. Majority of them used a combination of group-based discussions where they brought parents together to to have the sessions. And then they also had sessions that were really focused on individual parents that were now, they went to their homes or had meetings with them to discuss their specific issues that they're dealing with their own children or within their homes. And then a number of them designed their messages considering the gender of the parent that you are dealing with. Some of these programs worked in contexts where you had to be careful about what you say to women and what you say to men, and which sessions you have both women and men together or have them separately, and that was something that we found that majority of the programs were deliberate about, really targeting their messages based on the gender and of the parents and age of the children that the parents had. And again, as I mentioned before, a number of them were very strategic about reaching the fathers, taking the program to where the father is, starting to think about what timings are more suitable for men, because in many of the contexts, men were the ones who went off to work. So starting to design the curriculum and delivery methods to be able to allow them to attend. So those were the key things that we found in regard to the approach and delivery methods and formats that cut across the programs. Next slide. So based on that, we had some recommendations that we developed based on our observation that the opportunities that we saw in regard to future research and programming. And I just summarized this into three. The first thing that we saw is that there was need to create space within parenting programs for them to innovate and develop, implement and test specific interventions for families experiencing IPV. The key thing that we have found, even as we implement right now and try and take forward some of this work that we found in our evidence review at the collaborative, is that there's still lack of enough data to inform programs, particularly parenting programs that are not fatherhood programs. Most of the data that we got that were actually from gender-transformative programs were through fatherhood programs. And so we still see space where we can work with other programs to borrow from these good practices that we saw from the fatherhood programs, but also considering what other components would really be put together to come up with a model that works for those who are not in that space. And then we see a need to find complementary ways to measure relationship quality, IPV and VAC outcomes beyond self-report. As I mentioned before, for IPV, many times it's self-report by men. And for VAC, it has been self-report by caregivers. How do we get to have the survivors themselves or the people who are actually experiencing this violence also give their report as a way of measurement? And then finally, we saw a need to design and test different interventions, modalities, formats, and delivery platforms to respond to the different populations based on their group, their needs and the context. Again, most of our data is on the younger children. We still have parents who have middle-aged children, adolescents. What models work for this? And so there's a lot of room for research, and there's already enough information that we believe that programs can start using even as they work and strengthen their programs to be more gender responsive. Thank you.
Great, thank you so much, Lina. Really appreciate that overview. I just wanted to alert folks who may not be tracking in the chat box, but there is a lot of, if you go there, there's a lot of additional resources that folks have alerted the group to, and we will make sure that when we send out follow-up that a lot of those resources are available to you, but you may want to take a look. Right now, what I'd like to do, though, is turn things over to just two friends of the collaborative who have been trying to be on this learning journey. One is Clara Alemann, who is currently working with Promundo, but has served in the past as one of our prevention mentors. It's a program the collaborative has where we partner in learning partnerships with groups who are trying to innovate in this area and in prevention in general. And Clara was working with one of our colleagues' groups in Kenya on parenting, and she's going to offer a few reflections. The second person we'll hear from is Thandi van Heyningen, and she is also a new friend of the collaborative and has been working in South Africa, also thinking about how to innovate in this area. So I just want to turn it over to Clara briefly. These are just going to be some 3 to 5 minute reflections on some of what they've been seeing in the field as we all try to sort of begin to sort this out. Thanks. So Clara, over to you.
Thank you so much, Lori, and I'd love to thank all of the fantastic team at the Prevention Collaborative for organizing this, but I know we have little time, so just dive into what I wanted to share with you, which is how exactly can we use the types of findings and recommendations and guidance we came up with in this review to work specifically with partners such as the ICS, which is an organization in East Africa, and how we've been working all of the past year and are finishing that work. So ICS and the Prevention Collaborative started this learning partnership in 2019 to engage in a process of co-learning and strengthen their parenting program to intentionally prevent violence against women and address the intersections with violence against children, which they were already doing through their curriculum. One of the key objectives was then to unpick and revise their parenting program theory of change to include violence against women prevention and to develop specific contents, methodologies, and strategies in their curriculum to address both types of violence in the family and through also promoting gender equitable relationships. So we did a lot of what Lina described of what we thought were recommendable strategies to work with teams. We were very lucky to, I don't know if we can show the first picture or slide. We were lucky to have a workshop in person before the pandemic with the ICS team in Kisumu. And through 4 days, we got to know their program on the ground through their 3 teams in Kenya, Cote d'Ivoire, and Tanzania, how these worked, what challenges they faced, who actually participated, mostly women in some countries, men also in Tanzania. We shared some foundational concepts about gender norms, what gender transformative approaches were like. We shared the findings from the evidence review and started to think about how these really impacted parenting behavior, family relationships, and how restrictive and gender norms drove different types of violence against women and against children in the communities. We did several experiential exercises, like the one in the picture. This was the power walk. Many of you might be familiar with it, but the whole team was exploring their personal beliefs. Even if they are experts in preventing violence against children, they were exploring their personal beliefs and attitudes related to gender roles and these social expectations that Alessandra was mentioning about how women and men should behave, and also as mothers and fathers, and how this affects all of that nurturing care we would hope children receive, and of course, lack of violence. So we reflected a lot about gender roles and how this intersected with power imbalances in the communities in which they worked. Then, next slide, please. We also worked with the teams in applying the frameworks and new concepts about the intersections of violence against children and violence against women. And you can see in this diagram how we actually mapped with them where they knew from their experience that violence against women and violence against children occurred in the communities. What were the common gender norms driving them? What were the common risk factors and consequences? And you see Carol to the right, like writing all of these things, and different teams did the same, and we analyzed it together. So on the third slide, We can see the types of exercises we continue doing. Unfortunately, during the pandemic, we couldn't meet in person, but we continued meeting throughout the year, monthly, and continued facilitating interactive workshops with the team, where the team thought very carefully and rigorously about how restrictive gender norms, again, about female expectations about being a man or a father and a woman or a mother, were affecting the goals that their skillful parenting program was seeking to achieve regarding strengthening family relationships and well-being. So, for example, how norms around women's role as mothers and their responsibility to keeping the family together was maybe pushing women to tolerate IPV, to be good mothers. And if you see circled in orange, some of the things that came up from the group about what the community expected was driving women to tolerate whatever husband said or be subservient, and men, of course, to be in control, be angry when problems arose, and also provide financially, which at the time of the pandemic, of course, was a key source of stress and frustration by men. So we thought a lot about how these financial stresses were particularly affecting well-being and family relationships and driving violence at this time. Second, next slide, we looked specifically at these common elements that Lina was talking about from effective parenting programs that had addressed both types of violence. And so the ICS team identified critical issues of gender, power, and violence that were compromising the program goals that I mentioned regarding family strengthening and helping parents feel confident to parent, reducing their stress levels, improving their communication skills and nonviolent discipline skills. And so they also identified not only which of these common elements were already present in their curriculum, they were doing very well, of course, covering very well all of the aspects related to promoting nurturing care and positive discipline. Those are the two ticks in green, I think, above. But the three components below were not present in their curriculum. So we identified which of these common elements they wanted to develop further in their curriculum. And so what we are finishing now and the work of unpicking session by session of their curriculum is ensuring that these components are integrated in either the sessions that exist or creating new activities or even maybe a new session. So integrating a gender transformative approach into the entire curriculum that now aims not only to prevent violence against children, but intimate partner violence in particular by challenging the root causes of violence against women and children that Alessandra was talking earlier and Lauren as well. So the curriculum will very explicitly now include participatory experiential activities to challenge restrictive gender norms, discuss how power imbalances in the family and the gendered socialization of children and promoting can be strengthened through a parenting program. This was not present in their curriculum. In the next slide, we see the final areas in which we've been identifying specific opportunities to integrate either new activities or specific guiding questions or methodologies to bring this in their curriculum. So again, addressing challenging gender norms, power imbalances, promoting shared decision-making, caregiving, and domestic work between men and women caregivers or fathers and mothers. And this involves, they are developing a specific strategy to engage fathers as caring, equitable, non-violent caregivers, and also a lot of how they can raise girls and boys in gender equality or in gender equitable ways. So in terms of delivery, the sessions now are much more, or are including very participatory activities so that fathers and mothers learn through social learning and through observing others and practicing these new behaviors or skills in safe spaces. I mentioned the strategy to involve fathers. When possible, groups will involve one woman and one male facilitator to model shared power and decision-making with the group. And also every session is closing with well-being exercises to promote positive mental health, which was an issue that appeared very strongly during the pandemic, that was a risk factor and driving violence. So I rushed through it. The final picture shows us all together while we were learning with parents in one of their communities in Kisumu. So I hand over to you, Lori, and happy to answer any questions about this experience.
Great. Thank you so much. And actually, I think quite a few of the questions you'll be able to speak to when we go into discussion mode. So now just to get the final piece out on the table so that we can begin to exchange, I want to turn the board over to Thandi, and who could tell us a little bit about the work that they're trying to think through in South Africa. Thanks.
Thanks so much, Laurie, and thank you so much, Clara, for a very interesting presentation. It's always interesting to hear what other people are doing around the work. So my name is Thandi van Heyningen, and I'm a senior research consultant in the Justice and Violence Prevention Program at the Institute for Security Studies in South Africa, and it's a Pan-African NGO that's focused on human security. So as we've heard in the previous speakers, for many women and children, home is not a safe space. And the work that I'm sharing with you today is actually work that's still in progress, and it's ongoing research around how the work site can become a safe space for the delivery of violence prevention interventions that are an integration between violence prevention aimed at gender-based violence or intimate partner violence prevention, and at violence against children, preventing violence against children. But we also know that violence impacts people's performance at work, and it's linked to absenteeism, it's linked to reduced productivity at work, job losses, and reduced opportunities for women, and that women are also more vulnerable to experiencing violence at work, especially for women working in low-skilled positions or in male-dominated sectors. And workplace violence can also occur in the form of harassment or bullying, and also sexual and physical violence. However, there's an opportunity here that needs to be taken advantage of, and that is that the workplace might provide a delivery platform for violence prevention interventions in South Africa and in other places, other settings. And for women in low and middle income countries, there might be an opportunity to make the workspace one of the safe spaces that Clara mentioned, and especially when home is not. And work sites also create access and improve access for working women who might not be able to attend community-based programs. And this is especially true for women who are working in low-skilled positions, who do shift work, and who often work very long hours and don't have capacity to attend or to take time off work. There are also incentives for employers here that need to be taken advantage of, because violence prevention programs may reduce those factors that we mentioned earlier that have an impact on the bottom line or productivity. So absenteeism and staff retention. So here is an opportunity that is almost, it's a win-win sort of situation. And the workplace has the potential to be a space where women can become empowered, where employees can be trained in life skills that can improve the family relationships or improve how the family unit functions, and to reduce and prevent violence at home and in the family units. So we also see that the workspace can be potentially transformed into a place where women can also access resources in a supportive environment and stay economically empowered at the same time. But there's very little research from low and middle income countries on such interventions for family violence prevention, especially for those delivered at the workplace. And there's a corresponding lack of evidence to guide policy and program development for the private sector to respond to family violence prevention. So we have used both human-centered design and traditional research methods. And through that, we've identified multiple evidence-based components and are busy developing a blended violence prevention intervention. So one that is aimed at preventing both intimate partner violence and violence against children. And this is, to our knowledge, the first workplace-based intervention in South Africa that is addressing both of these forms of violence simultaneously. So we are looking at a group-based delivery with content that includes those that were recommended in the review that was discussed earlier. So addressing gender roles and power imbalances, gender-transformative content, encouraging healthy communication and conflict resolution, promoting self-care and mental well-being. We have components on positive parenting to improve parent-child relationships and to promote non-violent discipline. And we're also looking at integrating a component around alcohol and substance abuse. And importantly, we are wanting to design this program to transform workplaces themselves and to shift gender and racial inequality. And the aim is for managers and business owners to participate in the program too. And we also want our intervention to include the development of guidelines for businesses so that they can draw up policies and protocols to better support individuals who are experiencing or perpetrating violence, and by providing a compassionate response and the right kind of information and the referral to resources for further support is also part of the aim. So we are working with government departments such as the Department of Trade and Industry and labor unions to try and find ways to encourage businesses to be more supportive of women and of violence prevention. And lastly, another exciting opportunity that we are looking into at the moment is how businesses who engage with our program could incentivize or influence their supply chain to do the same. And we are keen on seeing how this blended program can be implemented across a supply chain once it has been pilot tested. So in a nutshell, that's the work that I'm busy with. And I thank you all very much for listening. And I'm looking forward to hearing some of the questions and feedback. So back to you, Laurie.
Great. Thank you so much. So that is a lot of information really fast, but what I'm excited about is, and we were just talking about this the other day with some of the colleagues who are on this call, there seems to be lots of different things popping up in this space. And it's nice to start to hook up all of the dots, as they say. And I think that there's a lot of work that we can do together going forward, both to share as we're learning and to make sure that we actually create a community of folks who are working together on these issues. So we have a lot of questions and comments in the chat box. One thing that we can commit to is make sure that if we don't get through them all or they're very detailed, we'll try to follow up with you individually or collectively to make sure that you have some of the resources of the questions answered that you raise. A couple of them, though, I think look around this whole issue of the curricula. And so I wanted to perhaps bring a few of those together. One thing that we have noticed is that the people who work on violence against women and the gender transformative programs have a long history of techniques to raise these issues. They have been done with couples and with individuals and with men and with women. But they haven't actually penetrated yet the family strengthening or parenting space. And so some of what you're seeing, I think, is this kind of creative merger of some of the things that are kind of, just par for the course, the way the work is done in one sector, now coming together creatively in the other. And so rather than thinking about that the challenge is to just add a module on violent, intimate partner violence, I think it's really to help integrate some of these self-reflection and participatory techniques that are sort of routinely used in gender transformative programs into the parenting space, and vice versa. some of the insights from the parenting space about intimacy and emotional regulation, and some of that. So one thing I wanted, one question that I thought was interesting to start out with, because you actually put it on your slide, Clara, is a colleague, and I apologize if I mispronounce your name, but Tulanongo Matabiwi, she asked us whether or not the training guides and the work that you're doing includes anything about gender socialization of children. And you mentioned it on your slide, but you want to take just a moment about some of the ideas, or any of you actually, some of the ideas that have come up about how to do that creatively in some of the existing parenting and family strengthening programs. So I'll turn it over to you, Clara, and then if anyone else wants to chime in, that would be great.
Thanks, Lori. And sorry, I cannot probably pronounce properly the name of who asked the question. But yes, indeed, this is something that is usually not in parenting programs. And I guess it has two ways of approaching it. First, it's through the reflections that parents themselves are starting to have or start to have about how social expectations about their roles as women and men and how they are expected to behave are the same ways in which we raise, which girls and boys are raised. It's like boys are encouraged to take risks, to be strong, to play with certain things, to protect their sisters, to not to cry, not to show vulnerability, right? While girls are allowed to express all of their feelings, but not take risks, and not do this and not do that, and be subservient. So one is being aware of that and how that is affecting their child's whole development, their child's exposure to everything life has to offer, irrespective of the gender. And then specifically providing parents with some ideas of how to encourage both girls and boys and all children of all gender identities to just explore different, to develop physically, emotionally, to take risks, to make decisions, to be involved in caregiving and nurturing activities and games that oftentimes are not allowed, for example, for boys, like to cook, to play with babies, with dolls. So giving specific examples with the types of stories they tell, the songs they sing, the games they use. So using gender neutral educational materials that can be amenable and in which we are supporting kids' development in terms of their individual skills and preferences and styles, but not based on their gender. And also importantly, to role model positive or equitable relationships at home by parents and caregivers. What we were saying before about sharing, from decision making to caregiving to mothers and fathers that do everything, work outside the home, earn money, wash the dishes and cook. So yeah, those are some of the ideas that we can integrate and are integrating into curriculums, and hopefully more will start doing this.
Great, thank you so much. So just looking over here, I can just comment real briefly on a couple of them and then pass on to the next speaker. So we had a question somewhat about what are the theoretical underpinnings of these programs. And I just wanted to alert folks that one of the things we're doing at the Collaborative is a big review of all of the curriculum-based group programs, not so much in the parenting space, but right now in the gender transformative space, in order to pull out those insights and hopefully create a resource that allows us to basically look at best practice, so that will be available more widely for folks who are trying to do this work in terms of the intersections. I think also Krista Ridley asked an interesting question. She says, well, what about the inverse? What about, do IPV prevention programs deliberately address violence against children? And what are the incentives and disincentives to do this kind of joint research? And I think this is an intriguing point, right? Because what we have seen is until very recently, most IPV programs have not actually, in the same way, they've been very siloed in the sense of focusing much more on women and not explicitly focusing on children. But a lot of the evaluations are showing that even without an explicit focus, what you see is that there are reductions in harsh physical parenting, for example. And we're really encouraging all of our partners and people that we're working with that if you are working on violence against children, please track what's happening with women and vice versa. So I think what we really need to do now is start to figure out how is that generalization working through these programs so that they're actually, we're seeing these things and how to be more intentional about it. Because there may be things that we can do that actually up the impact. I see here that there's a number of people like our colleague Alice Wellborn, who's been a champion of the Stepping Stones program for a long time. There's other programs as well where, again, they both have started on, let's say, with adults and now develop curriculum with children and have the experience of working not necessarily on parenting per se, but working with a broad range of people and seeing both positive effects in violence against women and children. So I think we have a lot that we can build on. We just haven't brought it together yet. So let me just pull here. There was a question here that I thought was interesting and saying from Katie Medanowska about whether parenting programs are, why they don't actually use or are they using addressing sexual and reproductive health more explicitly as an entry point to begin addressing some of these issues. And I don't know if anyone has ideas on that or whether UNICEF has examples, for example, of programming that starts from more of a sexual and reproductive health focus, but actually works on some of these issues around family strengthening. Anyone?
Laurie, I can, not that we have, well, Lauren may come in with some specific examples, but I think that that's a really excellent point. And in the paper that we shared, we highlight comprehensive sexuality education as an opportunity to address many of these issues, obviously around, issues of consent and healthy relationship formation. So Lauren, I don't know if you want to come in with some specific examples, but just to echo that that's a really important point that we're exploring.
Great.
Nothing to add from my end. Thank you so much, Alessandra. I think the questions are fantastic. The bottom line is, although we're seeing these promising interventions across many countries where we're working, few are systematically documented and few are operating at scale. Largely because of funding issues, but also because of some fears that I talked about, fears that it's too complicated, fears that quality will be compromised. And so I want to just echo what everybody else is saying about the importance of investing in the operations, in learning how much training, what kind of training, the duration and intensity of such programs. These really matter to dispel fears and get these programs off the ground at the type of scale that's needed.
Right. And I think one of the things that we're trying to do, and I think we can do more of as a community, is think of those really simple things, like kind of a gradated approach, right? Because not everyone's going to be ready to pull all of this in at once. But if you are doing a parenting program or early childhood development program about reading to children, what are the books that actually are being shared? What are the social and gender norms that are portrayed in those books? What are easy things that we can do to begin these conversations? And then as we move up, we have that whole agenda of kind of both researching pathways. There's a lot of questions here about pathways. How do we understand that better? And I think we have two things we need to be doing in parallel. We need to be moving forward with innovation and really just learning by doing, and then also learning by studying. And they should be moving forward at the same time, and we creating communities that bring those two insights together. So let me just look here. I think that there's a couple of questions here about reaching more male partners. And I know that's a classic challenge with some of the work with parenting. And so I was wondering if anyone had any observations that they wanted. This is a question asked by a couple of people about ways in which people have started to address this, or even started to think about how might we begin to address this in these programs. And this goes to both making sure that all of the burden is not just on women, but also that we do know research shows that engaging fathers productively in parenting actually has a lot of positive impacts for children. So does anyone have any initial thoughts or ideas they'd like to share around that? I don't think it was directed at anyone specific. Perhaps Clara?
Yeah. So yes, this is a long time challenge, and because we all think, and everybody working on parenting, of course, when we talk about parents and caregivers, are thinking about male and female, but in practice, we know they just don't go. If the parenting intervention, if the ways to reach them, if the messaging, if the places, if the time of convening is not really meeting men where they are. And this includes from understanding their concerns around parenting as fathers, understanding what might hook them to a parenting intervention, which, because of the traditional division of roles and labor, they don't associate as their responsibility. Their responsibility is to bring, we know, money to the family, but not to be caring, not to read books, not to take sometimes kids to school. Usually these programs, so first understanding that, and some programs have been effective when they, for example, ICS has a program in which it has been effective in engaging men because it has associated it to economic opportunities or livelihood strategies. Promundo, as you know, works very intentionally to engage men through different types of strategies, but basically understanding always first through formative research what are men's concerns, and then also very practical and operational aspects as where to meet them, what day, what time, when are they available, who are some leaders, or for example, Real Fathers works with, and also Bandar Berejo in Rwanda from Promundo, from very selected, respected community members or trainers that are very also thoroughly trained into how to reach out to men and engage them in a way that they feel talks to them. And then through the methodologies we described, as Lina and me described, it's reflecting together with their female partners about a more collaborative way to co-parent, and how as a team results for the whole family, for themselves as men, for the women and the children are definitely strengthened and boosted. So again, there's content, strategy, and very operational or logistical aspects that help engaging men and keep them engaged throughout the intervention.
Great. Rachel Marcus, a colleague of ours at Overseas Development Institute, was saying, perhaps you, Thandi, could say just a bit about the degree to which, if at all, the workplace focus was geared at all as a way or what you're learning about the possibilities of engaging men through that area. And just another observation, when we've been working with ICS in Tanzania, they actually worked specifically with agricultural extension agents. So they went to the places where men, the roles that men are playing, and started there, and then got their partners involved, as opposed to the other way around. So Thandi, do you have anything you want to add just to the discussion?
I wish I had the answers to this, but this is something that is very important, and something that we are definitely looking into as to how to engage men. So the work site that is our research site is actually mostly female. It's an agricultural processing site, so mostly women who work there. 90% of the employees are women, but we are definitely engaging men as well in our groups, in the group-based activities. And when we are looking at scaling up the work or piloting it, we will definitely be looking at work sites where there are more men. For example, the surrounding farms that supply the vegetables to this packaging site are mostly male employees. So we definitely will be looking at how to engage them and how to and what that will look like. So I mean, it's all very much still up in the air, and but we will definitely be sharing that as soon as we have any more information to share, and looking forward to that. It's something that we discussing at length in our groups. Yeah, thanks.
Thank you so much. And I'm afraid we're actually out of time, but I hope we can all see this as the beginning of a conversation. There's clearly a lot to talk about, a lot more to share. I'm just amazed at the amount of things that people are sharing that are going on, and we will again try to make sure that everyone has access to that after this. I also want to alert you about ways you can stay in connection with the Prevention Collaborative. So here we do have a monthly digest, and to get that, as well as the webinars, you can sign up on our website. Come June, we're going to have a brand new website, so stay tuned for that. You can also follow us on Twitter or on Facebook or in LinkedIn. So I just really want to thank our panelists today, and I really want to thank everyone who's trying to do this work, because it's not easy. It takes us out of our comfort zones, but also it's exciting because we meet new colleagues that we haven't worked with in the past. So with that, I think I will stop today, and we look forward to the next in what I hope is a long series of conversations about this topic. Thank you so much, and for all the great questions.
Bye. Thank you.
Bye-bye.